Welcome, everybody. I'm happy to welcome you today to today's Job to be Done webinar. We have a special topic today. We want to look at opportunities for innovation in the medical diagnostics industry. And for that purpose, we have a special guest. But before we come to our guest, let me mention a couple of points on the agenda. So today we will introduce you to the power of jobs to be done theory and outcome-driven innovation, and how we implemented it and used it at 𝗪𝗂 Biosystems. So we will talk you through the steps of the process and also show you what 𝗪𝗂 Biosystems did with the research and with the results from that study. This is the overview of the agenda. I hope you can all, everybody can see the slides in a good shape. If you have any issues, please use our chat. You can also use our chat, for instance, to ask any questions. We will take care of them as we go along. My name is not Martin, as you can see here, but I've been jumping in for Martin today, who is unfortunately sick. My name is Oliver Ratschka. I am a project manager at Edison Innovation since 2016. And actually, it's a nice coincidence because I was the one conducting the project with 𝗍𝗂𝗏. So it's unfortunate that Martin is ill and he cannot join. He sends his regards to everybody on the webinar. But, you know, it might be fortunate that we can talk about more details about the project in this manner. Now, as promised, I would like to introduce our guest today. We have online 𝗍𝗂𝗏𝗏. Eberhard is Director of Strategic Development and Innovation at 𝗪𝗂 Biosystems. He is based in Heidelberg, Germany. And yeah, happy to have you here, Eberhard.
Thanks a lot for having me, Oliver. Good to see you again.
Yeah, good to see you too. Right. So let's take a look how our journey started a couple of months ago. There were some innovation challenges you were facing at 𝗪𝗂 Biosystems. So let me take a look at the initial situation at the end of 2021. So you have a long track record as a company in offering products and services in the histopathology workflow, isn't it? And so far, the focus was on automation at that point in time of manual steps and adding steps to add diagnostic value. So that was, in a nutshell, the situation end of 21. If you want to add something to that, please jump in.
Yeah, just for the audience who's probably not familiar with histopathology, just to give you a bit more background on that. Histopathology is basically, it deals with the science of tissues. Yeah, so whenever you go to a doctor's office, to the hospital, and you get some tissue removed, which needs to be analyzed, that's where histopathology comes into the play. So that is, of course, when it's about cancer, but also infectious diseases, but bacterial-based diseases. It's actually quite a span. And the discipline is fairly old. So the roots go back 150 years. Loads of manual work. There are roughly 400 steps, individual steps you have to take from a biopsy to a result, which is quite a lot. So this is as the frame up that we have, an old workflow, very much established over the past 150 years. Only steps were added up to it. So a lot of manual work, a lot of automation. That was basically what has been done over the past years. And we were faced like, is that all? Or is there more to it? And
okay.
If you want to, I can jump into the innovation challenges.
Well, that's fine. So yeah, you can do that. Sure. Let's take a look at those. So there were three points, weren't there? Basically, that you wanted to tackle with this project.
Absolutely. Actually, the first one is still one of my favorite slogans from the Danaher Corporation. So Leica Biosystems is part of the Danaher Corporation. And Danaher defines a strategy as a valuable difference the company can defend. And I think that makes actually a lot of sense. It does not only, it's not about getting something new out there, it's also something new out there which you can actually defend against your competitors. And the big question was like, that in mind, where should we put the R&D dollars in there? Yeah, rather than doing another round of automation, another thing other competitors would do. How could we do that different? Yeah, and how can we create, based on that, a product and service strategy based on customer needs? And so far in the past, we were also always thinking about customer needs, but probably bridging the gap now to you to job to be done. That was something which appeared to us quite attractive, because we said, well, that's probably that gives everything a bit of a different spin in looking at this.
Okay. Yeah, thanks for that intro to the innovation challenge. And at that point, Leica, you and your team, you approached Edison to employ jobs to be done thinking in the project. So what I want to do next is I want to introduce you to the process of outcome-driven innovation and how we put a new lens on innovation in your case. So jobs theory, in a nutshell, it takes a different view of customer centricity, which was one of the cornerstones in your endeavor as well. People buy products and services to get a job done. I think this is a very essential twist to analyzing a customer centricity problem. People buy products and services to get a job done. They don't buy products and services for itself. It's not what they want to do. They want to get a job done. So it makes perfect sense to make the job the unit of analysis. So what is it that people want to achieve in their day-to-day jobs? And eventually what you want to do then is you want to define markets, needs, opportunities, not around the solutions that exist or have been existing in your case for 150 years. But you want to segment the market around the opportunities that exist in the job. So that's, in a nutshell, the philosophy, if you wish, of the approach. Now, when you look at the process of outcome-driven innovation, which is a process, I need to stress that, because it's really the employing the philosophy that we've talked about just now in practical research and strategic steps. So where it all starts is at a definition of your market. Of course, that is critical. You want to define your market in a way that it offers you enough space for innovation, but it's not too far away from a space that you cannot defend, as you put it. So this is totally critical. And I would say it's one of the most important steps in the whole process. So if you get the definition of your markets wrong in the first place, all the other steps will be much more difficult. So if you enter on the journey with outcome-driven innovation, be prepared to invest some time and energy on that step. It's very important, but it also pays off. Step 2 of the process is to uncover desired outcomes and the customer needs. I will be showing you how we do that. But what it really is, it's really analyzing the jobs to be done in a very deep level of granularity. The ultimate goal of that step is to have a list, have an inventory of all the needs that exist in a job to be done, no matter if they're mentioned by just one person or two persons or three persons. That's beside the point at this point of the process. What you want to have is a complete list of needs, first of all. With that list of needs, that comes out of step number 2, you go into the quantification in step number 3. So how we do that typically is we select a sample of so-called job executors, so the people who actually execute a job to be done. And we put a survey in front of them that contains all the needs that we found in step number 2. And we ask them basically 2 questions. First question is, how important is each of those needs that you see in this need inventory? And second question is, how satisfied are you with your current opportunities, your current possibilities to solve these needs, to address these needs, to achieve them? And with those 2 data points, and of course, we also ask another set of questions around the work context, the context in which the job takes place. But with these 2 central data points, we can quantify which outcomes are unmet, and also we can also see which outcomes are appropriately met or even overserved. But this is not all. The most important part of the process is step number 4, I would say. It's the most interesting part in strategic terms, because the methodology allows you also to discover hidden segments of opportunity. What does that mean? Hidden segments of opportunity. I will show you later some examples, but typically in traditional segmentation techniques, what you do is you take predefined criteria like age or country or industry size or whatever demographic comes to your mind to split a market into sub-segments. In our case, what we do is we forget about all that for the time being. We take the profiles of needs and try to identify groups of people, groups of job executors that have a similar view on the needs. So we try to group people together that have a similar needs profile, if you wish. And then the data also allows you to look into the details in terms of demographics. And with this approach, you can then explain why people have different needs in certain segments, where they come from what segments they are, and why that is. So you can explain their needs profiles in more depth. Step number 4 is then to take the data and formulate and deploy a winning strategy. It's really important to mention here that with outcome-driven innovation, you have a really evidence-based approach to innovation strategy. So anything you do at the end to deploy a winning strategy, you can always prove it with data from the market. And of course, last but not least, you can also use the data to generate ideas, create concepts, and use the data as a guideline, as a guiding principle for your solution generation. This is the process in a nutshell. Let me take you through each of those steps in more detail. Now, step number 1, we said we want to define the market in a way that it allows us to have room for innovation, but not too far away from our company so that we cannot defend the space that we're in. So the questions are, who do we want to create value for? So who are the job executors that we want to create value for? And what is their job to be done? So make no mistake, there are job executors that have multiple jobs to be done. So you have to make a conscious selection what you want to focus on. In our case, in the Leica Biosystems case, there are many job executors in the ecosystem around cancer diagnostics and tissue sample analysis. You have the surgeons, the physicians, so the surgeon who actually extract the sample from the patient. You have the pathologist who looks at the tissue samples, but you also have the lab manager or director of labs and the lab technicians who work with the tissue samples. So one of the first questions was, who of those people do we talk to? And there's certainly, you can even think of more people involved in the ecosystems, but these were the first, target points, if you wish. And so the question was, who of those do we want to talk to, and what kind of job to be done do we want to focus the conversation around? So what we agreed on is to look at the histology laboratory technicians slash managers. I'll come to that in a second. And the job to be done we want to understand is to visualize microscopic detail in cancerous tissue structures. Visualize microscopic detail in cancerous tissue structures. You don't see any solutions in there. You don't see any of the apparatuses that Leica offers, for instance. So that's critical. Define your job in a way that it actually expresses what the ultimate goal of your job executors is. Now, you can see here histology lab technicians. Sorry, my voice is leaving me. And we said also managers in brackets. Now, in this particular case, the decision was that due to the structure of histology labs, we want to talk to those people who have a broad overview of the process, because when you think of it, the histology laboratory has a very, let's say that there's a big division of labor in the histology laboratory. Maybe Eberhard, you can expand on that a little bit. But what we wanted to achieve is we wanted to talk to people who have an overview of the whole process. And at the same time, we made sure that these people, those who manage the histology lab, also are not too far from the actual the actual desks and the stations where the tissue samples are analyzed. So they needed to have a background as laboratory technicians, but they also had to have the overview.
Oliver, maybe just jumping in, because there's a question related to that from Steffi Kaiser in the chat as well.
Yes.
To be quite frank, that's a very critical one, and we I remember we spent quite some time on thinking about what the best way is, how to approach it, and we came to the point where we said, you know what? Yes, the technician is the person who is actually using the instrumentations. However, frankly, they don't have a say. Yeah, they are not responsible for what is bought at the end of the day. So you need to have somebody in there who actually has the power to make a decision. And the lab manager position is much closer to that. And it's kind of a hybrid, because that person on the one hand side really understands the workflow, and on the other hand has impact on the decision making of buying a product or technology. Yeah. I guess that was the driving factor. And Steffi Kaiser,
absolutely.
Please, I hope that answers your question.
Okay, thanks, Eberhard, for the time. Yeah, Steffi is happy. Thanks for that. Thanks for the question, by the way. There's also another question. I didn't overlook that by Manfred, but let me make sure to postpone that question to a little bit later when we talk about the quantifications. Very good question, by the way. Now, so once you've defined the market, what comes next? We want to take a deep dive and uncover the desired outcomes, the customer needs that exist within the job to be done. Now, here's a little bit of theory, of practical theory. How do we do that? how do you analyze a job to be done in a good way? And our suggestion is to use a job map, the universal job map as it is shown here. The background of this job map, the idea is it comes from Six Sigma. It assumes that a job is a process, and you can, like in Six Sigma, you can analyze processes by splitting them down in the essential steps. And any job to be done, you can argue, has 8 key steps that need to be performed either very consciously or subconsciously, but they need to be performed in order that the job gets done perfectly. So put in another way, if you don't prepare your execution bit, so if you don't prepare whatever has to be prepared before you can actually do something, you're bound to fail in the execution. Or if you don't define your goals of the job, so if there's problems at the very beginning, it's unclear where your journey in the job should actually lead you to, you're bound to fail. So the principle is that we want to find out what comprises a job to be done, what steps are comprised in a job to be done, that need to be done perfectly in order to get the whole job done perfectly. So the job map is a blueprint for us to look at something. It helps us to steer and guide the interviews, because we talk to job executors about the job to be done. We observe them in some cases. And it is a blueprint so that we not forget any aspects of the job to be done. It is also a blueprint for showing and organizing the results of interviews. And what you come up with at the end of each project is a customized job map for the particular job to be done that you're analyzing. So how did the job map look in our case? Let me give you a brief overview. And so this is a schematic example. Unfortunately, we cannot show you the final results from the project, but this is a very close example. So in the job of visualizing microscopic detail in cancerous tissue, what are the steps that someone analyzing this and visualizing microscopic detail, what are the steps that this person has to go through? First of all, they need to be clear about the requirements of the analysis. They need to determine the requirements of the analysis. So what is the goal? What do we hope to identify in that tissue sample? Second step is locate. In this case, you want to locate the cancerous tissue in a larger tissue sample. Now, if you visit some of these labs, these histology labs, what you see there is in the morning a pile of tissue samples in all kinds of sizes. It ranges from very tiny tissue samples, like a couple of millimeters, maybe Eberhard, you can also expand on that a little bit, up to really buckets of samples where whole organs are being preserved before they can be analyzed. So in this step, what you want to do is you want to identify where's the part, the region within that sample that we want to look at. Eberhard, please jump in with some practical details anytime you wish to.
Oh, actually, I think you already brought quite a picture already. And I remember it's really like very, very fine needle aspirates where you have tiny little samples up to, I remember going into a lab and there was actually the lower part of the leg. And I mean, there's anything.
Well, not too many details at this early morning hour.
So it gives you an understanding like how difficult it can be to really focus on the critical critical point of interest.
Mm-hmm.
So
yeah,
that's a challenge.
So the next step is then to prepare a cancer tissue sample for analysis. There are certain steps before you can actually look at it, put in simple terms. And then before you make the tissue sample, the structures visible, you need to enable access to cellular level information. That's how we framed it. The execute part was then to really make cellular structures visible in the tissue sample. And in monitor, you want to control the tissue processing steps. You want to actually make sure that you're on track, that everything goes according to plan. And in some cases, although this is kind of it's a bit of a special step here, modify. In some cases, you need to reprocess. Let's not make the mistake that there is innovation potential, a lot of innovation potential in many jobs in this modify step, because we live in an imperfect world still, and people have to do things again, and helping them do things in a better way can be a first, let me make that clear, a first innovation, a start for innovation improvement. And finally, in our case, the conclude step, so when is the job done, basically? It's done when people can store a tissue sample for later use. Because in many cases, what happens is that a couple of weeks later or months later, you want to go back to that same tissue sample and reanalyze it for certain reasons, be it for patient treatment or also being for research purposes. So this is how we framed the job to be done in the Leica Biosystems case. And what we did is we also looked at the needs in each of these steps. Now, there are
Oliver, sorry to chime in. Maybe just for the audience, that was actually the first moment when the Leica team got an aha moment. Because everybody who's working in their own industry, we all believe that we know everything and everything is very clear. When it comes down to pin down the steps precisely, it's actually interesting how much you struggle to do that. And it was a very, very good exercise, sometimes a bit painful. And of course, what you see here is only the version we can show you, because there is quite some I'd call it intellectual property behind it. So, of course, that's very much simplified here. And to Francesco's point in the chat, yes, of course, I mean, you can imagine that whiteboard was full, at the end of the day, of jobs to be done. Yeah.
Right. I mean, to Francesco's point, right, you could deep dive into each of those steps and actually make it a job of your own and analyze it again. But, as in many cases, you need to stop at some point and find a level of analysis, a flight level of analysis, where you say, okay, that's going to offer me the granularity I want for innovation, and that's right for me. So this is absolutely true, and there's no cookbook recipe for that. It's a process that we typically go through with our clients together. And it's, as Eberhard said, it's a very, even in this early phase of the project, I think you can learn a lot. It can open your mind to innovation very early in the process. So how do we proceed then? When you have the initial job map, and by the way, this is something that is it's not carved in stone. It develops over the course of interviews. So every time you learn something new, you try to challenge your job map and use it for, yes, you're welcome, Francesco. You use it to test your assumptions about the job to be done, and eventually you come to a point where all the information, where you don't learn any new information anymore. So additional interviews don't give you any new information, and that's typically. Let me foresee that question because it's being asked very often. So where is that saturation point in terms of interviews? It's somewhere, I would say, depending on the job to be done, somewhere between 10 and 20 interviews, somewhere in that space. And there's also literature, market research literature, that has proven that the saturation point exists. Now, what else do we do? Apart from structuring the job map here, what we want to find out is, what is it that people want to get done faster, more predictably, and with a higher ratio of output versus input, so with higher efficiency. So these are the three ways, principal ways, to get a job done better. You want to do something faster, you want to do it in a more predictable fashion, so with less errors, less variability, or you want to be more efficient. Now, here are some examples from our case. So if you look at locate step in our job map, one of the needs that we heard, or that we extracted from the interviews, was that job executors want to minimize the time it takes to identify a degraded tissue sample upon delivery to the lab. So they've been reporting about cases where, for some reason, during transport or even during extraction of the tissue sample, something happened that rendered the sample unusable, and you don't want to go through the whole process to find out in the end that you cannot visualize any tissue sample, any structures in the tissue sample. But you want to, make sure that this is identified very early in the process. So that's why we put it at the beginning of the job map. People want to minimize the time it takes to identify degraded tissue sample upon delivery to the lab. Yeah, thanks for taking care of that questions in the chat, Eberhard. Here's another example from another job step. When job executors prepare a cancer tissue for analysis, one of the needs that they have is minimize the likelihood of failing to capture a region of interest in the sample. It can happen that, because you cut these tissue samples into slices, it can happen that you miss some of the regions in the sample that are actually of interest, and so you dump them, or you stop cutting the sample too early until you get to the actual interesting bit. So this is one of the issues that have been reported. But certainly, Eberhard, you can explain that probably in much more scientific and better terms than I can.
Yeah, but I guess it's here to convey how we do that, rather than going through the science of histopathology.
Right.
But I'm happy to discuss that with anybody in the audience.
Great. Here's another example from the execute step. Job executors, so the technicians, lab technicians, they want to minimize the likelihood of contrast variations within the sample slide. So they want to have a kind of uniform way of making these cellular structures visible. They want to avoid zones with more contrast, with less contrast, so that the histopathologist at the end of the day can actually assess it in a good way, and is not being distracted or misled even by contrast variations. Here's another example from monitor step. Job executors want to minimize the time it takes to track back an error in the lab process. So when something is weird or wrong about a sample tissue, they want to be absolutely quick in determining where the error happened, whether it happened in the preparation step or in the actual visualization. What was the problem? So it's a need that they have in monitoring the process. So in a nutshell, what your job map in your case will look like at the end of the day is something like this. So you have the core functional job at the top. You have the detailed job steps that are relevant for your particular job to be done. And in each of those steps, you have a number of outcomes. So over the whole job map, typically you will find something between 50 to 200, sometimes even more, outcome statements. And this is your set of statements that you want to put, at least partially, into the survey in the next step. Now, even at this step of the process, you can use the results very well for strategic decisions. You can take a look at your organization and say, okay, what does it take to get more of the job done on a single platform? Because that's the guiding question for innovation. What can you think of? What solution platform can you think of to get more steps of the job done? Some companies are focused very much on the execution of a job step, but I wouldn't say forget, but they have neglected for several reasons, preparatory steps or steps that follow the execution, which offer huge innovation potential very often. The second question you can ask yourself, if you want to focus on a certain job step, what is it that you could do to get the job done better and cheaper? So that's the second question. Get more of the job done, and what can you do to get the job done better and or cheaper? You can start with those strategic questions, as I said, even after the qualitative results. Now, what follows then? We said we want to put the outcomes to a survey. How do we do that? Two key questions, like I mentioned in the beginning. First question is, you put the outcomes into in front of the job executors, a larger sample of job executors. Depending on the target group, the sample size can range somewhere between 180 to a couple of thousand users, job executors. Of course, in some markets, so many job executors don't even exist. So the thousands of users, that's probably an example from B2C markets and fast-moving consumer goods. Anyway, what you ask is, when you execute a certain job step, how important is it to you to minimize the time or minimize the likelihood, and so on and so forth? So that's the first question. How important is it to you? Second question, how satisfied are you with your ability to achieve that, to minimize the time it takes, or minimize the likelihood of that? And those two data points give us the opportunity to come up with an opportunity landscape. This landscape, you can read it basically in this way, that on the one axis, on the x-axis, you have the importance scores of your sample. So let's take one example here. For instance, this dot here on the bottom right. This means that somewhat over 80% of your sample set, this is a very important outcome. So each of these dots is one outcome statement, and 80% of the sample set, this particular outcome statement is very important. So it ranks high on the importance scale. But on the other hand, it ranks very low on the satisfaction scale. So just 20 or a little bit above 20% of the sample said, yes, I'm satisfied with my ability to achieve this. And once an outcome comes into this area here, which is termed underserved, it tells you that there's a huge opportunity for innovation, for new solutions, because what you want to achieve with innovation is that people are more satisfied with their abilities. So you want to move each of these dots basically into that direction, to the center of the graph. But there's also needs that are overserved. And let's not forget about that part of the map, because this offers also innovation potential. If a need is overserved, but it's actually, so it's important, but it's actually also oversatisfied, so to speak, you can take out performance out of your products, out of your services, take out focus, and people will not be dissatisfied by you not offering any support on these. What this means is you can save money, you can save resources that you can put into the development of other outcomes that are much more important to the market, that are much more underserved. Last but not least, in many projects we find table stakes. These are on the top right corner of the opportunity landscape. What does that mean? These are needs that are very important, but also very well satisfied. Typically, that's a picture in traditional markets, long-standing markets, where there's a long history of proven solutions. People are very satisfied with them. So in those cases, what is recommended is that you monitor these needs closely and make sure that the satisfaction and that the satisfaction rates remain high. And probably this is, we're coming close to a question of Manfred at the beginning of the webinar. We're coming closer to your answer. So what happens if you don't find any innovation potential in the market? First part of the answer from my end is that you should also ask your job executors about related jobs. Ask them not only what is it that they want to achieve in the core job, but also ask them what other jobs do they have to perform around the core job that you're interested in, because that offers you another trajectory of innovation. Now, let me speed up here a little bit. Next step then is to find segments, find hidden segments in the sample. Now, what we do is we take a look at the sample, and we split it into groups of respondents with different needs profiles. Here's a schematic picture of that. So in this particular case, you can see we split the sample into three groups, and you can also see the market sizes of those samples indicated with 10, 24, 57, and 19%. So in this example, we find a group of people, 24% of the sample, who have a lot of underserved needs in a certain job to be done. And on the other hand, there's another group of people who are pretty much well satisfied. They have a lot of even overserved outcomes. And a picture like this probably calls for a differentiated innovation strategy on the part of your company. Speaking of strategy, let's take a look at the next step here. What you want to do with the data is formulate and deploy a winning strategy. How do we do that? So the data should guide your decisions, but what are the principal directions your strategy could take? Let's take a look at this. Remember, one of the goals is to get the job done better or more cheaply. So this opens a playing field of actually five areas. Let me start with a differentiated strategy. We can actually jump to the next picture because that's the example that we used before. So when you think about this segment that we identified in the example with 24% underserved outcomes, who have a lot of underserved outcomes, well, what you want to do here is you want to win underserved customers. You want to have a differentiated product service strategy that wins these customers. You can probably think of it like a special offering, a high-priced, high-quality offering to these people who are also willing to pay more for your solutions because they struggle a lot in the job to be done that they're trying to get done. So what you want to do here is you want to get the job done better, and you can charge more for that. So that's the differentiated strategy. There are cases where it makes sense to run a dominant strategy. You want to win all types of customers, be it whether they are underserved or overserved. And this is what we call a dominant strategy. So you want to find ways to get the job done slightly better, but also look at ways to charge less. So that will probably be a strategy that the whole market likes if they get their job done better and they can get it for less money. So you dominate the market by that strategy. Another way of looking at it is to run a disruptive strategy. What you do here is, for instance, in the segment on the left here, what these people have, they are overserved. They are not looking for a better solution in terms of technical performance, but for them, solutions are on the market today. They are more than good enough. So you want to give them a good enough thing and charge less for it. So they will like solutions that are cheaper, but help them somewhat. They don't need to get the perfect solution, but some support that costs less. So you want to win overserved customers and even non-customers. So people who haven't used any supporting technologies or solutions, this is your chance to win them. And there's even a fourth quadrant here. You might wonder what this is. So getting the job done worse, but even charge more. So there are some markets that offer this opportunity. If you think of airports, for instance, you're thirsty, you're in behind the check-in, there's scarce supply of drinks. So there's definitely solutions that get the job done worse than anywhere else, but you're being charged more. So there are markets where it makes sense to think about solutions that are inferior to other solutions out there, but make you put you in a position to charge more. And a sustaining strategy is a strategy that you want to run if your market is somewhere in the middle towards the table stakes. You want to monitor it. You want to sustain your position. You want to sustain the satisfaction of your customers in that part, and make sure that the satisfaction rates don't drop. Now, where can you use results from outcome-driven innovation projects? You can use them across the entire organization, I would say. You can use them in product strategy. You can use them for product road mapping, product portfolio management, for instance. You can use it for digital strategy making. You can think about the top underserved needs, for instance, in a way that you say, okay, how can we address any of those top underserved unmet needs with a digital solution? Which of those lend themselves to a digital solution? So you can come up with a digital roadmap, a digital service portfolio, and so on and so forth. You can also use, as we've seen in the strategy pages, you can also use it to make decisions about your business model. You can validate your business model. You can think about new ways of bringing your product into the market. Now, and finally, last but not least, marketing strategy. This is one of the first cornerstones you can use the data for. Very often in your organization, you already have solutions, technical solutions, service solutions that address certain needs, but the market just doesn't know about them. So you can think about your value proposition, recommunicating your competitive strengths, and so on and so forth. Now,
Oliver, maybe just one comment to that, because I think that's really essential. Innovation doesn't necessarily mean you have to develop a new product, which runs for a year or 3 years and costs X million euro. There are so much lower hanging fruits, as you just described. It helped us to look differently on what we already have and how we can differently communicate it, and that already helped.
Yeah, I think it's a good point in time to also look at the concrete steps in your project, Eberhard. Maybe you can expand a little bit on that, how the process was implemented at LBS.
Absolutely. I guess it's twofold. What we've seen is we had this large-scale project, Oliver, where you were heavily involved. You were basically leading. So it was about going through the complete workflow and understand, do we have any white spots, which we do not serve. That actually helped us finding areas which are attractive. And there was one question from Frederick in the chat. Of course, I cannot go into detail, but sustainability, I'd say, is one of the big headers I would see here. Like, there's a lot of waste in such a laboratory, and we all try to become greener, and the greener lab starts getting more attention. So those are areas which are absolutely not traditional workflow related. It was a given that you have waste and have to take care of that. So that was one of the big findings, and that is now taken into our road mapping process at 𝗏𝗏𝗏. And basically now you have to put it into a decision making, which project runs first. You have a project funnel, you have an innovation funnel, that every company has that challenge. How do you put that together? But that is outside of ODI. What this helped us with is having new areas where we can actually do something. That's the long-term one, especially in medical diagnostics, it's long-term. And the short-term one is the integration of the job to be done methodology into our processes. DBS stands for Danaher Business System. So we do have quite massive tools. And there was another question in the chat about other tools. What we did is we combined job to be done with the tool set we already have in other areas. And I have to apologize already for all the product managers which are listening to that here. Usually when you go to people who are together with customers, most of the time they tell you, we know their needs. I can tell you all of them. It's quite interesting when you actually take a 2-day session and start sitting together with them and say, okay, let's not talk about what they need. Let's talk about the job they have to be done. And that actually helped us dramatically, in making people think differently, rethink what they believe, what they know, which sometimes is quite interesting. When you boil it down to the job, that actually levels people on a different way. So we actually took that method, we took a part of it, not the complete ODI process, but the job to be done thinking, to very discrete workflow steps, and applied that to our processes, to our ideation processes, several ones, which really helped us refocusing, double checking what we believe, and making a sanity check if that actually makes sense. And again, very, very helpful in that regard, as a much lower barrier, actually.
Mm-hmm. Right. Maybe a mention of the, implementing the results in your organization. What could also help you is to make the data more accessible to a wide range of people in your organization. And for that purpose, we can also offer a dashboard that helps people who are not so familiar with ODI data yet in a very simple and easy way to take a deep dive into the data, take a look at the opportunities that exist within a certain job in certain parts of the job map, and drill down and even compare segments with each other in a very simple and graphic way. I think this is something that can also help in the second challenge that Eberhard mentioned. We'll be sharing some of these screenshots with you. But I want to also give Eberhard the opportunity to summarize what has come out of the project and how you're dealing with the results in your organization.
Yeah, I guess there are two bigger lines, I would say. If you go big, if you go small. Yeah, and it's kind of referring to what I showed you just a slide before. If you go big, if you want to go run an ODI project, you need to have your management buy-in. Yeah, if you need to have the buy-in for the invest, I mean monetarily as well as resources. Yeah, because that doesn't fly on its own. It's hard work. I don't know how much time we spent in there. It was quite a bit because you have to deep dive. Yeah. The other one is, I can only recommend to get professional guidance. Yeah, we actually reached out to Edison. We started ODI basically taking the book, yeah, reading through it, starting applying it, and after 3 months or so, we came to a point where we said, okay, what's the so what? What do we do with what we believe we came up with? And this is, I wouldn't say it's impossible, but it's quite hard without getting somebody in the boat guiding you towards the result. And it made a huge difference getting Edison on board. I believe, Oliver, please correct me if I'm wrong, I think the pre-work we did was not too bad.
Yeah, no, that's true.
We headed towards the right direction, but it was not efficient. Yeah. So if you want to run it economically, get somebody to help you. Yeah. Unless you are an ODI expert internally. And you need a decently sized team for that. And it does make sense to train your people, at least a core team, yeah, to understand the ODI concept. So that's if you want to go big. If you're going to want to go small, I would still recommend get some guidance to get the core team to have people who understand the methodology and can apply it in the smaller steps. Yeah? I guess that's what we achieved at the end of the day. So building internal champions, people who understand it and can apply it. And I guess I already jumped on that one. Try to identify smaller gaps. Don't take necessarily the huge workflow. Make it small. Use it within your already existing processes, and that can also help you quite a bit. And I guess that's probably my summary I can give you.
Mm-hmm. Yeah, great. I like your last point in particular, because we've worked with other clients who have successfully integrated job to be done thinking in their stage gate processes at certain points. So implementing job to be done within your existing innovation process, I think that's key, because you don't need to reinvent the whole world, but you can enhance it and make it improve it in that way. There's one question I would like to pick up from the chat. It's from Derek. It's a practical question on the research process, I would say. And Derek says he has faced some challenges in reaching out the the sample of job executors, and how do we do that? So how to make sure that the questionnaires are being actually filled by job executors. Well, there's a couple of factors. I think, like in any market research project, it's about being honest with the respondents. So we prepare them, we recruit them with appropriate information. We tell them what the study is about, how long it's going to take. And we ask them to reserve time and energy for that. And we incentivize them, of course. So we give them incentives that are appropriate for the time they invest. I think those are the key points. In some cases, it might make sense to also offer sharing of selected results. So this is another strategy you can use for incentivizing job executors. But over the years, we've been successful in conducting these projects, and participants typically enjoy thinking about their job to be done and the challenges that they have. Now, without much further ado, I would like to close this session with a couple of informations about upcoming events. So please visit our website of the JTBD Institute Europe to check out the program for the upcoming sessions. I would also like to thank Eberhard for being online here. We will also take a look at the remaining questions in the chat room and approach you. And we're here to help you and answer your questions in the future. Well, with that, thank you for your attendance. Thank you for your participation and your active questions. We wish you all the best, and we hope to see you again soon. And yeah, all the best for the start of the year.